Three more regions outside Metro Manila experienced measles outbreak following a spike in cases last month. These are Calabarzon, Western Visayas, and Central Visayas. The palace has now ordered the health department to fight the spread of the disease. Here's the full report.
The Department of Health declared a measles outbreak in three more regions outside Metro Manila. The DOH now raises the red flag over Calabarzon, which has recorded the most number of measles cases since the start of the year at 575. 9 patients had died from the disease. Central Visayas, which includes Cebu, Bohol, Negros Oriental, and Siquijor, has handled 71 cases with 1 casualty. In neighboring Western Visayas, which is made up of the provinces of Aklan, Antique, Capiz, Guimaras, Iloilo, and Negros Occidental, health workers there have handled over 100 cases. 3 patients succumbed to its complications. Earlier, the DOH declared an outbreak in Metro Manila and Central Luzon. Based on the DOH's records, there are more than 440 cases of measles in Metro Manila. 5 of the patients had died. While in Central Luzon, there are over 200 patients who have been admitted due to measles. The region also tallied 4 deaths because of the disease. The DOH is now keeping a close watch on other areas in Luzon.
We are expanding the outbreak from the Metro Manila to other regions as cases have increased in the past weeks, and to strengthen surveillance of new cases and alert mothers and caregivers to be more vigilant.
The palace has now ordered the health department to exert all efforts in stopping the outbreak. Presidential spokesperson Sal Panelo relayed that the health department is now working on a massive information drive to convince parents to have their children vaccinated. The DOH had been stressing the importance of immunization in protecting children from certain diseases such as measles. Health Chief Francisco Duque blamed the public's loss of confidence on vaccines to the Dengvaxia fiasco.
Ganun po talaga mahalaga ang immunization, ang pagbabakuna. So wag na po tayo mag-alinlangan, wag na po tayo magdalawang isip. Kung nakita ninyo at alam ninyo na hindi pa ho nakakapagpabakuna ang inyong anak, dalhin na po natin sa pinakamalapit na health center. Kung hindi po, sa bandang huli ang pagsisisi. Bakit po natin ipagkakait dahil lamang sa isang naging kontrobersiya, bunsod po ng Dengvaxia? Ilayo po natin, ibang issue ng Dengvaxia.
Based on their investigation, the anti-dengue vaccine was not the main reason for the reported deaths.
There is, in fact, Secretary Duque, I think, has requested PCOO to help in the information campaign.
Dengvaxia specifically, sir?
Yes, because according to Secretary Duque, their findings show that it's not Dengvaxia. It's more on pneumonia, heart disease, TB, the cause of death of all those children.
Public Attorney's Chief Persida Acosta has drawn flack for her office's investigation into the alleged Dengvaxia-related deaths. The PAO chief has since brushed aside these allegations. The palace seems to be on her side.
The PAO chief is responsible enough to know if her action would result into discouraging people or children of parents to have themselves immunized.
Measles is a highly contagious disease. It is spread by sneezing, coughing, and close personal contact. The signs and symptoms are cough, runny nose, red eyes, conjunctivitis, fever, and skin rashes lasting for more than 3 days. It's best to seek medical attention immediately when you experience any of these symptoms. Because of the outbreak, the DOH is now recommending the vaccination of infants who are at least 6 months old.
Again, please take note, here are the areas where there is a measles outbreak. In Luzon, we have Metro Manila, or the National Capital Region, NCR, as well as Central Luzon, and most recently, the Calabarzon region.
And as we mentioned, there's also a measles outbreak in Western Visayas and Central Visayas. Again, if you are experiencing any of the symptoms that were discussed earlier, please go to the nearest hospital or immediately consult your doctor.